Welcome again, dear students. I hope that you are doing well, and welcome to your English class with Mr. Zoe Adil, English teacher from the Directorate of FS. Today we are going to talk about something that is very important to you and to me and to all the people. It's our health and welfare, which is good being. Enjoy it! So, as you can see, you've got a family there, two babies, two kids. A body are surrounded by that medical objects, right? And then we've got some sports and relaxation, food, right? And love. Those components make all that could be a welfare, right? Happiness, right? But this is not the cause, this is not the subject. It is our subject to talk about health problems, right? Health problems or aches. So everybody is vulnerable or prone to suffer from headache, headache. The head aches that girl, or it could be you and me or any other person. Then we've got that boy suffering from stomach ache, right? And because of the food that is coming into our stomach, so it causes stomach ache or pain. Also, you've got the matter of toothache. A toothache, that is problem with our teeth. Another pain that we can or we may suffer from is a sore throat. The problem is not with the mouth and not with the teeth, but the throat, right? Look at the girl, she's touching her throat. Alright, look at the woman over there. It's not throat, it's not stomach, it's not the head, but it's the back. So we call it back ache. She's suffering from a back ache. Right? Again with the little girl or little boy over there, he's got a problem of earache, right? I've got an earache problem, pain with the ear. And not the air, because the air is the oxygen, right? And look at the boy there, curly hair but high temperature. It's called fever. Fever, high temperature. The red cheeks, it's hot, and that's called fever. The last one, but not the final, is the flu, right? When your nose is sneezing, you're not fine, right? You feel cold, you feel hot, and then there is that different feelings about this flu, right? Now you've got learned those kinds of health problems or aches. Let's do exercise number 1, vocabulary. What's the matter with these people? What's their problem? Match the pictures from 1 to 6 with the sentences from A to F, right? You've got 2 minutes to do it, please. Alright, I'm here. He's got a toothache. He's got toothache. So it's A. It goes with what? It goes with number 6. He's with the dentist, right? Toothache. you're gonna see a dentist. Good. B, she has got the short form like Si Muhammad, Simu, right? So she has got fever, high temperature, right? It's number 3, right? Number 3, that is it. He suffers from the flu, right? He suffers from flu. It goes with 5, right? Number 5. That's her nose. Her nose is sneezing and some other feelings that are not fine. D, he's got a backache. The back. It's with number 4. Backache. E, he's got a headache. Right? A headache. It is with number 1. Right? Number 1. His head is aching him. The last one is he's got a stomach ache. Problem with the food. The fruits, vegetables, meats that we eat and other products may cause us some problems. It is number 2. So the girl over there with the glasses has got stomach ache, right? Now, imagine that you've got toothache. Where are you going to go? Where? Of course, you're gonna see a dentist. Now let's check with this exercise. The same page, 41. Exercise number 2. You ought to see a medical specialist. You ought to. You should. You should see. You ought to see a medical specialist. Of course, medical specialist is a doctor. But the doctor of eyes is not the doctor of stomach, is not the doctor of the head. It's not the doctor of the eyes, right? So, match numbers from 1 to 6 with letters from A to F. 2 minutes, please. Alright, I suffer from, I have got a problem. I have a problem with my skin. So a skin rash. The skin, right? Not the bone, but the skin. The external surface of our bodies, right? So a skin rash, I'm going to see a dermatologist. Dermatologist, right? So he's a medical specialist in skin, right? Heart, the heart. Heart disorders. I've got a problem of heart disorders. So I suffer from heart disorders. My heart does not beat naturally and ordinarily, right? There's a problem with my heart beats. So heart disorders, I'm going to visit a cardiologist. Cardiologist, right? Cardiologist. Chronic depression, number 3. Chronic depression, right? It's always eternal feeling about bad mood. You're not okay, you're not feeling happy. So you are always sad. So chronic depression, I'm going, of course, to visit a psychoanalyst. Psychoanalyst, right? Number 4, blurry eyesight. Blurry eyesight. When I've got a blurry eyesight, it means that I don't see things so clear, right? I cannot differentiate. Is it number 1? Is it number 4? Alright, I'm not sure. So I've got a blurry eyesight. Problem with my eyes, right? So blurry eyesight, of course, I'm going to see an ophthalmologist, right? Ophthalmologist. Number 5, recurring indigestions. recurring indigestions, right? Problem with my stomach. My stomach is not working well. I feel fed up all the time, right? I'm fed. So recurring indigestions, I'm going to visit a gastroenterologist, right? So that I'm going to check what's up with my stomach. The last one is easy, of course, because we've got just a toothache, and the remnant one is a dentist. Whenever we have a toothache or problems with our teeth, we're gonna see a dentist, right? Alright, so let's move to exercise number 3, page 41. Find the nouns from those verbs, or these verbs. The verbs and the nouns, or the adjectives are here, right? Like fit, it's an adjective. Fit. I am fit. I am slim. Slim. Right? So fit is an adjective. I want to write here the noun. So what is the noun of fit? I'm helping you with this one. Fitness, right? Fitness. Then let's continue the things. Just 2 minutes, please. Back to you, so let's go. Obese. Obese. Which means you've got some kilograms, extra kilograms on your body, right? Extra, more kilograms than the normal weight, right? So obese means a bit of fat. Fat. Obese, overweight. Fat. There is a big difference between these words, but still it goes in the same path. So obese, obesity, obesity. More kilograms on your body, right? That's why you need to do practice some sports to be fit, to be slim. Now recover. Why do you take some medicines? Right? To recover, to be okay, to be healthy again, to become healthy. So recover, the noun is recovery. Recovery. Diagnose. When you go to the doctor, what does he do? He talks to you, and he touches your body by any other means of his materials to check upon you, right? And to see your temperature, right? It's called a diagnosis. To diagnosis, right? Checking up on you. Prescribe. So the doctor, when you're gonna see the doctor, he diagnoses you. Then he prescribes you to some medicines. So, which means that he writes some names of medicines. That's called prescription. Right? The names of the medicines are written on a piece of paper called prescription, right? Prescription. Aware. When I am aware, which means that I know. I am unaware, I don't know. So I am aware. The noun is awareness. Awareness. I know that smoking is dangerous. So I am aware about the fact that smoking is dangerous. Operate. Some people have got some illnesses, right? So they need to operate on them, right? Which means they go to hospitals, all right, and undergo an operation. Operation. Grow, to improve, to increase. Grow, to go up, not down, go up in number, in places, in any other thing that could be growing. The noun is growth. Growth. Prevent. Prevent, it means simply stop. To prevent something, to stop it. So the noun is prevention. Prevention. Stopping something from happening. And of course, able. Able. I am able to speak English. Which means I can speak English. Simply because I am an English teacher. I am able to speak Arabic. Simply because I am a Moroccan. And my mother tongue is Arabic, right? So the noun is ability. I have the ability to speak Arabic because my mother tongue is Arabic. I want you to remember those nouns because we are going to need them in this exercise. Number 4, page 42. Let me help you with the question. Fill in the blanks with the appropriate form of words. Alright, so I want you to remember those words, those vocabularies as I have mentioned before, to use them in this exercise. Number 4, page 42, right? So let me clarify things. Fill in the blanks. Fill in, this is a blank. Fill in the blanks with the appropriate, the okay, the suitable form of words from the table above. You see, remember we have seen fitness, obesity, recovery, diagnosis. We've got many other words. So you have to use them in this exercise. 2 minutes, please. Here I am to see what's up and what have you done with this exercise. So, A, you are a bit obese, overweight, some extra kilograms on your body. So you are a bit obese. You should go on a diet, on a tough diet, to lose some weight, which means that you've got to play some sports, stop eating some food, right? And then you're gonna lose some weight. B, you don't need a doctor's prescription, which means the paper on which we are writing the names of medicines, like aspirin or something like that. So you don't need a doctor's prescription to buy some medicines such as aspirin and cough syrup. Of course, when you've got a headache and you want to drink a pill of aspirin, you don't go to a doctor, so there is no need for that prescription. C, I've just learned about your illness, your sickness. I wish you a speedy recovery. Which means that you are becoming healthy, right? Good health. D, prevention is better than cure. Prevention is better than cure. This is a proverb, right? Even in Arabic, we've got it. So prevention is better than cure. I know that smoking causes cancer. Smoking causes cancer. So, which is better? To stop smoking and no cancer, or to cause cancer and then go to the doctor? Right? So it's better to stop or never smoke cigarettes than no cancer and of course no doctor, no need to cure. But if you go to smoke, of course you need to cure. And who knows? It's not guaranteed. The last, or E, it's not the last one. E, Layla. What's the matter with Layla? Layla does aerobics. She's practicing some sports. Layla does aerobics to improve, to increase her fitness, right? So, of course, Layla does not want to be fat. That's why she's practicing aerobics, right? She wants to be slim. She wants to be fit. The last one, look at the photo up there, the doctor and the patient. Doctor, patient. So what is the doctor doing here? Is it a massage? Not really. Writing? Of course not. So the doctor is diagnosing, right? The doctor is diagnosing what's wrong with the patient. He's checking what's wrong, what's the problem with the patient, right? Of course, I want you to take care of your health by practicing some sports, no smoking, and eating healthy food. So, see you later, take care of yourself, and goodbye.